So, Richard, the same question to you. What does One Health mean to you, and why is it important?
Yeah, thanks, Malik. And again, I want to also echo my thanks for the invite to join this important meeting. And I don't want to waste everyone's time by essentially going over the same things that James just said far more eloquently than I could. But, One Health to me is clearly this mustering of people from different disciplines to address these, I guess, traditional cross-boundary diseases. So again, investigators working across our usual silos to answer questions important for all sectors. I guess my personal, interpretation of it has morphed a little bit over time. And again, started off with that more perhaps traditional initial approach of sort of the veterinary community and medical health community working together to understand some of these zoonotic pathogens. But, I think as James said, it's now expanded a little bit, and I think much more of a realization that there are many, many more players in this One Health sphere than just those two. And again, I think pandemic preparedness is one of the poster childs for a One Health approach. It's clear that when we see some of these zoonotic pathogens in humans, we have limited preparedness resources. So we have to somehow prioritize where we put some of those resources, and to do that, we have to have some sort of comparative risk. And without understanding what's going on in these animal populations, how these viruses are moving around there, what controls their ability to jump host range, what environmental factors foster that, without any of that, we can't do pandemic preparedness properly. So I think clearly One Health fits right at the center of pandemic preparedness. And my personal role in that, I guess I have a number of bosses depending on what we're doing. So my bosses here at St. Jude in Memphis have given me a research mandate. So as you mentioned, Malik, under the NIAID SEERS program, we have a network of collaborators domestically, internationally, trying to understand particularly influenza viruses. Of course, like a lot of people, a bit more coronaviruses in the past 12 months or so, but understanding how these viruses evolve, are sustained in their animal populations, what controls their ability to infect humans, and can we identify ways to intervene in that process a little bit better. My other sort of boss is Wen Ching, who you're going to hear from here next in Geneva. But so from a more, action point of view, as a director of a GISRIS collaborating center, we are tasked with identifying some of these particularly influenza viruses, zoonotic influenza viruses, that we think are of heightened risk moving forward to actually making some of the vaccine seed strains against some of those viruses. So in that context, it comes down to exactly what I said before. We can't do that in a silo. We know when we see something in humans, we have to understand the spread of those viruses in animal populations, how far they are, are they localized, are they dispersed, are they causing disease, et cetera, et cetera. So kind of that's where I sit in the whole One Health sphere, Malik.
Thanks.